back. This is Boomer Life on CL650.
Can't you hear the pounding of my heartbeat? 'Cause you're the one I love. You're the one I love.
Hey, and welcome back to Boomer Life on CL650. We're here with NexGen Hearing, talking about hearing issues, and our guest today is registered audiologist Dr. Ted Venema. And the song talking about hear the heart beating, you can hear blood flowing past your ear sometimes. It depends on which way your head's cocked, right?
Yeah.
And is that normal?
Well, you know, some tinnitus is pulsatile like that.
Okay.
Some people's tinnitus will,
Yeah.
and you know what? A doctor then will say, you know what? That's not the normal kind of tinnitus. That's blood vessel related.
Oh.
And usually the source of that tinnitus will be more middle ear, which is your hammer, anvil, and stirrup, the little three bones behind your eardrum. That area is quite medically treatable.
Oh,
But the
okay.
inner ear, or cochlea, where all the hair cell nerve endings are located, that area is pretty impervious and inaccessible.
And so could you go to your doctor, your GP, and say, I have this ringing in my ear, and can they do anything for you?
Well, many physicians hear this, and too many people say, there's nothing you can do about it. And really, that's unfortunate. What a medical physician should do is rule out a brain tumor, because some tumors, the hearing nerve that goes to your brain, tumors of that nerve tinnitus can be a symptom of that. But if you've ruled that out, and they'll do that with an MRI or a CAT scan or whatever. But I think that the main thing to show someone who has tinnitus is to say, you hear it more sometimes than you do other times, don't you? When do you hear it the most? And the person will usually say, at night, when I'm trying to sleep. Good. There's your first handle of control. Because when you notice it more sometimes than other times, you can manipulate your environment so that you can imitate that. In other words, you can avoid dead quiet situations. You can put a radio between channels if you want. You can buy some
those
hippy-dippy background, new age, waterfalls, you can
And that
do
works?
that. It works.
Or just have a fan going
have
in
a
the room.
fan or an air conditioner going. That's a huge, advance for covering or masking the sound you're hearing in your own ear.
Right.
I like to think of it like, if you can give someone control, if you can give that person a handle of control, it's like being stuck in traffic, the analogy I give. You're stuck in traffic and you're going, oh, God. And then you look out or you ask somebody, what's the cause of it? You roll down, there's a truck tipped over up ahead. Oh, okay. Right
you know
away,
we're going to be here a while.
You know you're going to be here a while. Get the cell phone out, call home. Don't drive with the cell phone. But call home and mention it, because now you know the cause. And with tinnitus, if you can tell the person you've been seen by a physician, it's nothing dangerous. You don't have a tumor or you don't have a medical problem. It's just a drag. It's just a nuisance.
And
So
has it
see what
ever
we can-
gone away on its own? Or does it come for a spell and disappear for a
Yeah,
spell?
some people say that they notice it more when its onset occurred with noise-induced hearing loss, and that over time they've accommodated to it. I don't know. These things are all anecdotal.
And does it get worse? Does the volume increase?
No, it doesn't. Usually someone's just got it, and it's how badly he or she is thinking about it, perseverating on it, concentrating on it, just letting it bug you. And if the approach of tinnitus treatment is to get the person to say, it's just a nuisance. It's not a deadly cause. It's a drag, and guess what? You can manipulate your environment to reduce it.
Okay, so is there anything, like if you go to NexGen Hearing and say to them, I've got this ringing in my ears, it's driving me crazy. And what do you say to that person? What are the steps you go through?
Well, first of all people who work at NexGen are registered with the College of Speech and Hearing Healthcare Professionals in BC. All of them are therefore enabled or allowed to or are good at referring a patient to the proper person if the person comes in complaining about tinnitus. So not all of them are doctors, but they'll definitely know when it's time to refer. There are some audiologists at NexGen who specialize in tinnitus. One of them is Robin Brody. She's a master's degree audiologist on the island at the Royal Oak branch of NexGen, and her specialty is dealing with tinnitus retraining therapy, TRT, tinnitus retraining therapy. And it's a psychological approach whereby, and that's an interesting, you get the person to listen to something and you make an aggravating sound in the headphones, and you get the person to tune it out, to learn how to tune out the aggravating sound, kind of like a saw while you're trying to watch something.
Right.
And then gradually, that sound is made to sound more and more like the client's reported tinnitus.
Oh.
So the person learns to tune it out, learns behaviorally.
What do they call that? Cognitive
Yes.
therapy?
Desensitization.
Right.
They get the person to habituate it.
So there's all kinds of jokes about I've been able to tune my wife's voice out for all these years, right? The jokes write themselves, Dr.
Yes.
Ted. You've heard that before.
Yes. Well,
but you okay? So
Get the
you
person-
get that annoying noise in your headphones,
Yep.
and then you marry that up with the tinnitus or
Yes.
tinnitus, and then your brain learns
your
to
te-
avoid that noise.
Yes, your brain just learns to tune it out.
Hmm.
It's just there. Leave it alone. Yeah, just
And how successful is that typically?
quite successful. And and so what you're noticing in that approach is that you're using masking noise, you're using noise, and you're also using psychology, cognitive psychology, as you mentioned. And you teach the person to tune it out, literally. You desensitize the person to it.
Okay, now is there anything that you can do with the hearing aids? Like you
Yeah.
mentioned earlier that you don't want to be in a perfectly quiet room
No.
because that's all you focus on.
Exactly.
You could have a fan going. Can you do anything with the hearing aids? to do
Hearing
that?
aids, yes. Hearing aids, first of all, as I said before our last break, is hearing aids are accused of picking up background noise. Well, that cloud can be turned into a silver lining for the person who complains about tinnitus, because now the background noise that the hearing aid is picking up are serving quite well to mask or cover the tinnitus that someone hears. Also, some hearing aids are able to actually produce sounds. They're called
Oh.
tinnitus maskers.
Oh, okay.
And so you can choose what kind of waterfall or what kind of new age type of sound you want. And your hearing aid is not only making sounds louder appropriately for you, but you can turn it to a program that will actually, it will produce a sound that will deliberately cover or mask your tinnitus.
Well, that's what I was going to ask you, because we have these advanced headphones
Yeah.
now that do noise canceling.
That's right.
So as a noise, a sound wave,
Yep.
usually a jet engine or something.
Yeah.
These people travel and use these for being on. I use them
Yep,
all the time
I
on
do
an
too.
airplane.
Yep.
And you produce the opposite
Correct.
wave to cancel it
Yep,
out. So
out of phase. Yep.
with tinnitus or tinnitus, can you create an opposite wave to the frequency that they're hearing?
No, but it's a great question, Zach. I'm glad you're answering it. And the reason why you cannot do it with those headphones is because tinnitus is not an actual sound coming out of your ear.
It's just a perceived sound.
It's just you're the only one that hears it. It's not a sound that a physician or an audiologist can put up a stethoscope and hear. Okay, the only one that you can with that would be the pulsatile. Boom, boom, boom. That's more blood vessel related. Yes, that tinnitus is objectively audible and hearable. But most people's tinnitus is subjective. They're the only ones who hear it, and it's not an actual sound coming out of your ear. So they can't make a sound out of phase or opposite to cancel it.
So what you're saying,
All you can do is mask it with other sounds.
so what do? You do you mask it with another just steady tone,
No,
or do you put
Just good old background noise.
the
Just-
waves crashing on the beach?
You can do it anything you want at Alice's restaurant. I mean, you can put it's any sound that, and you don't want to make the cure worse than the disease.
Yeah.
You don't want to make the sound so loud that the blanket of masking noise is now louder than the tinnitus.
Right.
You just want to, as they say, mitigate it. You want to partially mask someone's tinnitus. You want to take the edge off of it. You want to just put a bit of competing noise in there just to kind of remove some of the irritating edge off the tinnitus.
And then you do the cognitive training to hopefully tune out the remainder.
Yeah.
And so when somebody has tinnitus or tinnitus, do they when they're going through the regular day, they've got the radio when they're listening to CIL, they're in their car, they're talking to their spouse, they have the TV on in the living room. Do they even notice it then?
No, they don't notice it as much. When they notice it most is when things quiet down. Now they're by themselves. Oh, now the TV isn't on. Oh, now
So with this masking that you're talking about, can you have it on and off during different times of the day, or is it going to be on all the time?
No, you can turn it on and off. Hearing aids are programmable, by the way. So most hearing aids that are sold have a remote control.
Really?
And you can raise and lower the volume. You can change the tuning of the hearing aid.
And do they have an app on your phone yet? Because that's the new one, right?
Yep, they do. Yep, they do.
And you were telling me last time you were on, I found fascinating, if you get fitted with hearing aids and you have it Bluetooth connected, you can be watching a movie on your iPad or on TV, and the audio's going straight to your head.
Correct. It's streaming straight through to your hearing aids.
Can you even do it for the phone calls in your car?
Yep.
Really?
Yep, you can. Isn't that unbelievable? That's what digital technology does. It allows. So hearing aids are often they're programmed wirelessly with Bluetooth. The practitioner, audiologist, or hearing instrument practitioner sitting there with a laptop computer, and the client is sitting a meter away, and the person's just tuning your hearing aids, and it's just done by Bluetooth. And then they can pair or couple it with your telephone, your iPad, your iPod, whatever. So you can get your music or watching TV. Your television can be set up that way so that the sound from the TV doesn't have to be cranked up louder for everybody else in the room.
Sure.
They can listen to it at the regular volume, but you are getting the sound streamed to your hearing aids, and your hearing aids are amplifying it precisely for you, for your particular hearing loss, what they call configuration, which means your sensitivity across the frequencies. And which brings us back to a point. Hearing aids are prescribed. Just like lenses are for your eyes, hearing aids have to be tuned for your particular hearing loss, which will be different from my particular hearing loss.
Well, what do you say to people who are listening to this and they've seen maybe ads on TV, often in the U.S. So it's like readers from the drugstore. You can buy a pair of reading glasses for $15, but you can get these hearing aids and they're cheap. But you get what you pay for.
You get what you pay for. I'll say they're called personal sound amplification devices. They're become quite controversial, and that's all happening actually now. Like in the United States, the Food and Drug Administration, they're trying to make these personal amplification devices, hey, that's the way to go, with hearing aids. And it's what a lot of those devices do is they amplify the bass. If you pay $25 for something, you're going to get $25 worth of sound. I mean, it's really quite inferior sound. If you want the hearing, and you've got no explanation, you've got no encouragement along the way. You're not wearing a device then that's prescribed for you in particular. You're just wearing something like general reading glasses that you picked up from the dollar store, and they may be helpful. They're okay, but hopefully the idea is it gets you into the world of hearing better. And if you're smart, you'll eventually walk into a place and say, hey, now fit me with a set of decent hearing aids.
Dr. Ted Venema is my guest. He's a registered audiologist with NexGen Hearing, and we're going to continue the conversation about hearing loss, hearing impairment when we come back on Boomer Life, right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.